Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Matt Ater. He's VP Business Development at TPG Interactive. Welcome, Matt.
Hey, John, it's great to be here.
Yeah, excited to have this discussion. I think we're going to learn a lot from what you have to share. But before we dive into today's topic, can you tell us a little bit about yourself and TPG Interactive?
Yeah, John. So I am in charge of business development at the company, and I am also blind myself. So I
Okay.
bring some expertise in the world of disabilities because of my vision loss. And TPG Interactive is an organization that focuses on accessibility. So we look at things like websites, mobile apps, kiosks, anything with a digital footprint, and how do we ensure that those are usable by people with disabilities?
Interesting. I mean, we obviously all know about this. We hear about it, we see it, but talk to us about what is accessibility and who does it affect? And give us a feeling for how many people in the US are impacted by, lack of accessibility or accessibility if it's done right.
So I'll start with the size, the number of people with disabilities. And that number can change because there's what we call permanent disabilities and
Uh-huh.
temporary disabilities. You may have one tomorrow. You could get in a skiing accident
Yep.
or trip down the steps, and then all of a sudden you have a temporary disability. But if we look at the fixed disabilities, these are ones that people live with every day, and they may get worse over time. They may adapt to those changes. Maybe they're getting it because of age. Maybe they're getting it because of a disease. We're talking one out of every four Americans has a disability today.
Wow.
And so those disabilities are broad. So, I have a vision loss. Somebody else may be deaf or hard of hearing. We may have people who are physically disabled and may use a wheelchair or a scooter. They may have limited use of their hands. You could also look at people with cognitive disabilities. So those are reading disabilities. When we think of those as
Hmm.
things like dyslexia and other impacts to reading. And then, of course, we have other disabilities that fall into those categories as well, between autism and other diseases as well.
Interesting. And you know me well. I've had plenty of temporary disabilities. And it does open your eyes to the challenges that many people face, like you said, permanently. So, there's a new proposed rule, Section 504 of the Rehab Act by HHS that has been proposed. Talk to us about that and what impact that will have on the healthcare industry.
So Section 504 originally was designed pre-technology, right? So it talks about reasonable accommodations to things that people with disabilities may need. And a lot of people would think of this from it could be from a school, it could be
Mhm.
from work and things of that nature. But now with digital and technology and all the things that we're faced with when it comes to digital health and technology, um, HHS is basically saying, hey, your websites, your applications, your medical devices, it could be a blood pressure machine. It could be something that checks your glucose, whatever those devices may be, they need to be accessible for people with disabilities. And today you may go into a grocery store and check your blood pressure because you don't have, a blood pressure cuff at home. Um, Maybe you're going to a hospital and you need to check in. Can you, with a disability, do the check in on a physical kiosk? Could you get your medical records? Could you, uh, after you get results from blood work, can you read those, uh, uh, the different stats that you get back and the recommendations from the doctor? Can you read your medication? So all of these things come into play when we're thinking about digital world today. So we have computers, we have mobile apps, we have these kiosks, and of course, all the medical devices that you could think of. And we need to ensure that people with disabilities can use those just like anybody else.
Yeah. Matt, help me understand, like, how is healthcare doing with this, right? I mean, I think in healthcare we feel like we probably are addressing this because we deal with so many patients that do have limitations or challenges that they, you know, need to have accommodations or other things to make it, you know, accessible for them. What's your experience with healthcare? Are we doing okay? Or, you know, how are you seeing it?
So I would say that it's probably about a 50% shot that you're going to get something accessible today.
Interesting.
Um, and that's, if you want to get your blood work done and you have to go to a place to get that work done today, there's kiosks that you would use to check in. They're not accessible today.
Mm,
So how does a person who's blind check in to get their blood work done? That's every time you go to the doctor, the next thing they tell you to do is go get your blood work done.
yep.
So what should I be doing? Should I always be coming with somebody? I mean,
Hmm.
is that a reasonable expectation? Today with you know, Uber and Lyft and things like that, I can go do appointments myself. I don't need to have my wife drive me because I'm
Uh-huh.
blind. So I could go to the appointment myself, but now all of a sudden there's a roadblock. That
Yeah.
roadblock is I can't check in. Um, if we look at medical devices, I would probably say it's again, a small number of medical devices that are made accessible today. And we think of people are diabetic and what do they need to do to check their sugar levels and things of that nature. Could they use those devices? There are devices today that are doing that. Now people are using things like their watches to measure and check their stats in terms of heart rate and things like that. Those are becoming more accessible every day. You look at what Apple's done with the Apple Watch and other watch-like devices that have been made accessible, but not all of them, right? And
Yeah.
will those fall into this category because they have health related data on it, right? So,
Yep.
sometimes we don't always recognize what's connected to us. Like I'll use the example in the entertainment industry. If you had a game box like Xbox or one of the other systems, Wii or whatever, I don't even know all the different systems. Some of these, if they also are cable boxes, now they're controlled by the FCC.
Mm.
Okay. Same thing here. All of a sudden, you're buying something for some use case, but that use case is health related. Now, the question is, will HHS mandate those to be accessible as well?
Interesting. Yeah, well, and you didn't even point out all the hundreds of health apps that are being rolled out and implemented in health systems and how accessible are those. I think that's interesting. With the proposed rule, like what's going to happen if they don't comply? If healthcare organizations don't comply and make them more accessible, are there penalties associated with it, or what's the
Well, I
impact
mean,
if
we're
they
going to have
don't?
to wait. I mean, it's right now it's a recommended rules. So, as government goes, they make, they're going to put out these rules and then everybody's going to comment on those rules and then we'll come back and see. But, what we've seen in federal rules, we're also going to see differences. If the feds don't actually do some penalties, you'll see states do it. You're going
Okay.
to see states like California who are very progressive around accessibility mandate something before even the federal government does. And then all of a sudden we have a wild, wild west when it comes to what each state is doing. So we actually do need the feds to do this and to do it right. But they typically don't like um, doing too much in terms of penalties until DOJ, Department of Justice, decides to jump in and say, hey, these are rules and we need you to regulate.
Gotcha. That makes sense. You talked about some of the areas that healthcare should be evaluating, making these things more accessible so that they're ready for the proposed rule. Are there other areas, or is med devices, the kiosks, what other examples should they be thinking about when it comes to accessibility?
Well, kiosks are exploding in this space because
Yeah.
it's difficult to get people these days to work. We're running out of skilled workforce, right? And
Yep.
so the fact that you show up to a doctor's office or to a clinic or a hospital and you need to check in on a kiosk is going to be normal going forward. And so I would say that those are good starting places. All the mobile apps you mentioned before, I mean, every time you turn around, there's another app to do something, right?
A portal, an app.
Right.
Exactly.
And that app may be something you're using to control something related to your healthcare. You know, if you have a CPAC machine, are you using an app to get your stats and check what's happening, right?
Yeah.
Um, you may have a monitoring system, connected to your body for something, and that's reporting data in an app. That app should be accessible. Anybody else with a disability should have the same rights as somebody without a disability. And like you said at the beginning of this, we have permanent disabilities and temporary disabilities. And the likelihood of somebody with a disability to uh, need care is high, right? They're showing up to the hospital just like everybody else.
Yeah. No, I mean your example of the lab draw was fascinating because I just had a lab draw with my child, and there was no front desk. It was
Yeah,
just a
that is it.
kiosk.
Yeah, they don't have the time. They don't have the staff to do it. So you have an appointed time, you go in and you check in on the kiosk, and then they'll call your name. But if you go in there and you didn't know the kiosk was there, if you're blind, you sit down, they'll never call your name,
Yeah.
So is that a reasonable expectation?
And I understand that feeling of despair a little bit because I actually wanted to talk to someone because my kid's mom had scheduled the appointment and I wasn't sure how to check in. Was it her info? Was it mine? Was it and there was no one to talk to. So there is this feeling, yeah, I felt even in that small instance of despair of like, what do I do? Where's it? Where's a human? And that's discouraging. So it makes sense why it needs to be more accessible.
Well, and now we think of telehealth, like,
Mm,
that's been an explosion during COVID, right?
hmm.
Those systems have to be accessible just like anything else.
Yeah.
Because I did a doctor's appointment and I had lots of forms to fill out ahead of time.
Mm,
If those forms weren't accessible, the 50 questions of have you had this disease or somebody in your family had this disease, you got to go through and make all those, check off all those things, right? I need to be able to do that without asking my wife to do it,
yeah. That's a
would
good
be my
point.
expectation.
So talk to us about what do you need to do to make these digital health more usable for all? I mean, you gave an example of a form. Like what does it take to make that accessible for someone like yourself?
So a lot of it's coding. So our company, one of the things we do is we sit down with organizations to map out accessibility strategies, and where we
Okay.
would sit down with somebody is figure out, okay, what are the kinds of things you're building, and how can we help you make sure that that's accessible? We can, sit down and say, okay, it's forms. Let's make sure that the forms have the proper field labels to them.
Mm,
Um, if it's a app, are they coded in a way that a screen reader can read them? Can somebody who has limited mobility completely use the application? If it's
hmm.
a video, are you captioning those videos? A lot of
Mm,
times there's videos, we got to make sure that they're captioned.
yeah.
Um, if it's a instructional video and um, captioning may not be the only thing. Maybe you need audio description or narration so that somebody who's blind knows what's happening on the screen. If all it does is play music and kind of show pictures as you go through a process of how to use something, that's not good enough. So now we have to add audio description, which is something a lot of people probably don't know much about, but because we're more focused in captioning today with videos, because you know, uh, I think everybody's kind of grown up with captioning as part of their life now,
Hmm.
whether you use it because it's too loud in your house and you need to see it, because the mumbling on the TV, or because you're at a bar and you need to see what's happening on the game. Everybody's now using captioning if they have vision, right? It's whether or not you use it all the time or just a little bit, but captioning now is part of everybody's life. Same with wheelchair ramps. It's part of everybody's life. Now we have to figure out how do we do the same with all of the digital content. So what we'll do is sit down with the company, map out what the needs are. If it's a website, we can scan websites with tools. We can also test the website with users, actual users of disabilities. Can they perform these tasks? And a lot of times people are thinking about the standards and compliance we just want to actually use something. So let's think about the usability of it. And if we can use it, then isn't that good enough? I would say yes.
Hmm. Interesting. So TPG Interactive, do you provide like say an accessibility audit? Is that a common thing
Yeah.
that organizations can do with you to understand how accessible or not it is?
Yeah, an audit is the typical term that we use in the field, but think of it as testing of a site or an application or a kiosk, and then we'd provide remediation recommendations. And then after you fix those, we can come back and check and
Test it
test
again.
and ensure that it's working correctly, and even provide what they call a conformance report, so a report to say that they've complied. And there's the both the audit side of the business as well as potentially a usability testing as well, where you actually have users with disabilities with assistive technology. In my case, it would be a screen reader. For somebody who's low vision, it'd be large print. For somebody who's physically disabled, they may use eye tracking software.
Hmm.
They may use speech recognition. And so it's applying those technologies against your applications, whether they're mobile apps or desktop apps.
Yeah. We have a hashtag ask patients. It sounds like we need one for accessibility as well, asking people who need the accessibility. It sounds like that's what you're doing, which is awesome.
Yeah, and when if you don't incorporate people with disabilities into your testing processes, sometimes you may not understand some of the user experience challenges. You could be fully compliant and still be very difficult to use.
Hmm. Interesting. Well, and let's talk about that because obviously, healthcare knows all about regulations and compliance, and that drives a lot of behavior in healthcare. But what are some of the other kind of non-regulatory, non-compliance benefits of accessibility to a healthcare organization or even, say a digital health app that might sell to healthcare?
Well, a lot of times we don't think, if we're walking around, we don't think about everybody else's situations. We're thinking about our own, right?
Hmm.
But if we look back at the two examples I gave before, which is captioning and ramps, we use them all day. Every American runs into a situation where they use a ramp. We crossing the street, we're pushing a stroller, we're moving a shopping cart, and maybe we're using a wheelchair. Maybe we're riding a skateboard or a bike, and it's easier to go up the ramp. Same with captioning, and I mentioned that before. You're at a loud bar at a restaurant. You could be in the airport. They don't even have the sound up, but they're using captions. Now we have to think about the same when we look at all these other applications. And again, I want to focus on the usability side first. If we look at color blindness, you know somebody who's colorblind and you don't even know it. So if you're not testing for that and making sure that you're dealing with color blindness, then you're probably impacting somebody right now. And so looking at those kinds of things, and they seem complicated, but checking color contrast is not hard.
Hmm.
It's really not. Um, Checking to make sure that your workflow makes sense is not hard. Do I and let's use an example in um, filling out one of those forms. If I don't code right, and let's say I'm going through the form and I have to check off everything I have any kind of disease that either I've had or somebody in my family's had, right?
Hmm.
But if I don't code it right, all of a sudden it's taking me 10 times as long to fill it out as anybody else.
Hmm.
And so if we're thinking about the number of people we can see, the number of patients, the number of um, uh, impacts to the patient, if I have completed that form ahead of time and got it in, now I'm speeding up the whole process when I get to the hospital. If I have to have a nurse go through and read every question to me, that's taking extra time,
Yeah,
right?
good example.
So it does speed things up. Um, so I would say that that's one benefit to the system. Again, kiosks, we talked about that before. They're going to be used if they're accessible. it makes it easier for everybody around me if I can sit down and complete the task right there.
Awesome. Matt, I had to laugh at your colorblind example since I have three children that are colorblind. So I understand it fully.
And we don't always think about it, right? I mean, you are because you have three children who have it, right?
Yeah.
But there's probably somebody in a boardroom today in a healthcare firm who can't read the PowerPoint slides because they're putting up color charts
Hmm.
and they're
Yeah.
not putting them up with color blindness in mind. So color contrast is a huge thing. And don't, don't assume that everybody sees like you do. Don't
Hmm.
assume that everybody can hear like you do. Don't assume that everybody can reach something that may not be in reach, um, if you put it up too high. I was at a conference the other day, and someone had built a kiosk, and they built it in a way which was shocking to me, that someone in a wheelchair would not be able to reach the screen. That's not possible. The ADA tells you straight up that you need to do this.
Right.
Okay. Look at ATMs today. There's a headphone jack on every ATM. There's Braille instructions on every ATM. They're in reach of a person in a wheelchair. They
Hmm.
have the standards down. If you look at that, you're going to be prepared for what's going to come through HHS, Department of Justice, or any other rules that come down the way.
Well, and it costs less to put it lower. So in many cases.
Well, I mean, you can't just cut the feet off, right? So,
Yeah.
um, and when we think about the numbers, I talked about one out of every four Americans. Think about all of the folks with disabled veterans. You know,
Yeah.
right now, the VA serves hundreds of thousands of people, millions of people with disabilities. They're in our they're living with us. They're living around us every day. Right now, they're not going to a normal hospital. They're going to a VA hospital, but they're being served because of their disability, because of being a veteran, and we should be thinking of them just like everybody else.
Yeah. Well, and increasingly the VA is allowing them to go outside to other organizations. That's a really good point. Yeah, I love the service that you're offering. Where can people go to learn more about TPG Interactive and the services you offer?
So I go to www.tpgi.com. You can also find us on LinkedIn. There's lots of great blog articles. I highly recommend people sign up for our blogs because there's great content that will help guide you through your accessibility journey. And one thing I'll say to people is, they say they want to become experts in everything. This is what we're an expert in, is
Yeah.
accessibility. You don't ask someone like the IRS to do something different. Their job is to collect money.
Yep.
Social Security's job, what is it? To send you money, right? Those are their tasks, right? This is what our task is. We're here to help companies become accessible. And it could be an application you're building for healthcare. It could be a medical device and you want to figure out how can I make it accessible? It could be a kiosk. We can help solve those problems with you as a partner.
That's awesome. Well, I may have to have you do an audit of healthcare IT today so we can improve as well. But I appreciate you, Matt, taking the time to share these insights and perspectives and kind of open our eyes to the proposed rule, as well as other ways to make, everything we do in healthcare more accessible. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Matt.
Thanks, Sean.